The conference this year is particularly interesting on the point of view of advancement in the diagnostics and the biological understanding of acute myeloid leukemia. I think one of the highlights is certainly the coming of age of next generation sequencing based diagnostic procedures to really try and stratify a very heterogeneous disease into groups where the prognosis, the outcome of the patients can be better predicted. And there's been quite a lot of papers that have basically approached a very similar question from a very similar point of view. And it's funny how the results are not 100% converging. So groups from Germany and France and the UK, they're all basically applying NGS-based sequencing to a restricted panel of genes which are now known to drive most of the leukemic process. And they've been studying both the relationship with outcome and the evolution of the clones after chemotherapy. And so probably one of the best studies is the one by the Haferlach group in Germany, where they basically showed that by adding the NGS-based stratification on top of the cytogenetic stratification, which is more commonly used in clinical practice, adds a lot in terms of ability to stratify patients according to outcome. And then other groups also study the clonal dynamics of this, and you can see that it's a little bit the verification of something that we've already known for quite some time, that there's a lot of heterogeneity. So some leukemias seem to acquire new mutations when they relapse, but other leukemias seem to just relapse with the same mutational structure that they had at diagnosis. And of course, an outstanding question in this field is whether the mutations that seem to appear at relapse are actually de novo acquired, or they were already present at very low frequency in the diagnostic at the moment of diagnosis. So I think we will still need a bit of a technical advances on this side in order to really answer this question. One funny thing is that not all groups are concordant on saying how much you can discriminate prognostic outcome based on the clonal structure at diagnosis. So there are some groups that basically seem to show that if you have multiple clones at diagnosis, you are more likely to undergo resistance, and then there's a shorter latency between the time it takes for the leukemic clone to then give relapse, compared to relapses that occur with the onset of new mutations. So as I said previously, it's not entirely clear yet how much this is going to transform the way you treat patients, because it's hard to tell whether you can tailor a chemotherapy specific for the high-risk groups that is any different from the therapy that's already being used. So it will certainly take some time before randomized trials can really tell whether NGS-based can also lead to improvements in overall survival.
And when it comes to that therapy, we've heard lots of emerging therapies coming out of this year's conference. Have there been any new biologic agents that have caught your eye?
Well, I think there is one mechanistic insight that's at least 3 groups have shown at this meeting. It hasn't translated into any new drug yet, but I think it provides an interesting perspective. Basically, a lot of groups, and there was actually also one of the presidential session abstracts showed that there is this very intriguing biological phenomenon of exchange of mitochondria between the leukemia stem cells and the stromal cells in the bone marrow that seems to be part also of the normal niche that you have in the normal hematopoietic stem cells. And there's a couple of groups that have basically shown that if you inhibit this particular shuttling biological phenomenon, that there might be some therapeutic advancement in there. And the interesting thing is that this is probably going to target specifically the leukemia stem cell population, which is the one that in a number of models of leukemia seems to be the population that then eventually gives rise to the relapse.
We've heard lots of research coming out of metabolic treatments before, but
Yes.
this is the first one that seems to catch the mitochondria themselves.
Yeah, there's also a number of studies that I actually haven't seen presented here at ASH, but I'm aware of that are trying to target the metabolism. So like you have oxidative phosphorylation inhibitors, for instance, but also other types of metabolism like autophagy. We heard Manuel Passeguet yesterday giving a very nice talk on the role of autophagy in normal and leukemic stem cells, or folded proton response and ER stress. So it's a class of biological phenomena that is definitely coming of age, and I'm sure it's going to translate into some new drug developments in the near future.
And I suppose looking forward to ASH 2017, 2018, I suppose where would you like to be with leukemias by 2020, say?
Well, I think that all the massive increases in understanding of the genetics and the biology of AML, it should really translate into changes into our therapeutic approach that hasn't actually changed much in the last 20 or 30 years. We're still basing most of our clinical practice on the 3+7 and on small variations on that. So I think that the times are almost ripe for some important changes in the way we approach that. Stratification based on mutations and the introduction of new drugs in the induction setting are probably going to make some difference in the near future.